paleo cardiologist, so we'll definitely touch on other natural ways to help heart health and brain health as well. But Dr. Jack Wolfson, he's in Arizona. You have integrative Wolfson cardiology and the doctor's Wolfson, is that correct?
Yeah, something like that. If you Google Jack Wolfson, you'll find me. But our website is thedoctorswolfson.com. Doctors is abbreviated in the practice is Wolfson Integrative Cardiology. But like I said, you'll find us. We're on social media at the Doctors Wolfson. And yeah, I mean, if you're looking for the best in holistic heart health, come on. You know, anyone is invited to come out to Arizona, or at least have a phone conversation from wherever you are.
Absolutely. So could you talk a little bit about your background, you know, your training, and then how you kind of made the shift into what you're doing today? Because, you know, I heard you speak in Montreal and I was just like, man, this guy he's on top of it. And your background is awesome. You're so well versed in cardiology, obviously. And we're just lucky to have you in the functional medicine and the holistic chiropractic community as well. So
yeah, thank you. You know, like my father before me, I'm a board certified cardiologist. My father was the first cardiologist at the Cleveland Clinic, first osteopathic cardiologist at the Cleveland Clinic, and then the University of Iowa, and then had a very successful career as the department head of cardiology in Chicago. And unfortunately, his career was cut short because he developed a brain-based disease called PSP, progressive supranuclear palsy, that I know you're familiar with, Dr. Ryan. It's very similar to Parkinson's. And at the time, I meet this young woman who is a doctor of chiropractic. And simultaneously, I meet her, and he's finally over at the Mayo Clinic getting the diagnosis. And Mayo Clinic says, we have no idea why your father is sick. We have no treatment for your father, and your father will be dead in 3 years. And within 3 years, my father died a miserable, cruel death. And Mayo Clinic has no idea why. And then I meet this woman, she's a doctor of chiropractic, and she starts telling me why. She says, he eats like garbage. He doesn't sleep because he's a cardiologist. He doesn't get sunshine because he's a Chicago-based cardiologist. He certainly doesn't get chiropractic spinal care. He doesn't, he's around pollution and chemicals and environmental toxins inside a hospital, which of course it's loaded there. And on top of that, a cardiologist is exposed on the job to a lot of radiation. So that's why your father is sick. And I just was blown away. And then she says, the same thing's going to happen to you if you don't change. And I said, I don't want this to happen to me. That Mayo Clinic has nothing, and you just told me everything. So if I can start changing, and believe me, as a Chicago taught cardiologist with all the food, all the bad lifestyle, the only thing, and my father drank too much alcohol. The only other thing that because I was like all that as well, including the alcohol front, was he took statin drugs and I didn't. So that was the final liquefaction factor of his brain. But in any case, that is the truncated version, to believe it or not, of how it all went down. But I started to change my practice, started to change my life, and started getting into trouble because I was referring out for real doctors like yourself. And the referring doctors were getting upset. So I finally had to leave that big cardiology practice with all the guaranteed insurance patients, guaranteed money, guaranteed security, on and on and on. I left all that to join the realm of the real doctors, and happy to be here.
Yeah, that's amazing. That's a leap of faith, because I mean, how far along were you in your career when you met Dr. Wolfson, Dr. Heather Wolfson, your wife?
Yeah, I was 3 years on the job. So I started as a hospital-based cardiologist in the biggest group in Arizona in 2002. And then we met somewhere in 2005. So, so basically I was already about 2.5 years on the job when we had met as far as a working cardiologist. And it took me a while to be able to leave that big group. It took me a while to really, listen, somebody comes in and rocks the foundation of everything you've ever been taught, everything that was ever taught to me by my father, who was my idol since I can ever remember, all the other cardiologists I knew. And once again, not only do you have to be willing to, any medical doctor has to be willing to give up everything that they learned and the foundation of everything that they learned, but also to give up the financial side. And that's really a difficult thing. That combination, to think almost like you've been taught this big lie as to why sickness happens. And essentially the big lie is we don't know why sickness happens. It just does. It's just genetics. It's just your bad luck. Everybody's getting it. You're getting older. That's the story that the medical doctors are taught. And then boom, it's a matter of identify the problem and then think about what is the pharmaceutical and or test or surgery or procedure that you can do on that person. And it's about volume. It's about getting people out of the office as fast as possible, again, so you can see more people. It's a really horrible, horrible scenario. But in any case, I've seen that side. And I think everybody now knows that side is an abysmal failure. You know, listen, one more thing real quick, Dr. Ryan, is that I've got a patient out in Arizona. And actually the husband, and then the wife, she was having some dizziness. And she actually talked to my wife, Dr. Heather, and Dr. Heather said, you got to go down and see one of these chironeuro people. His name is Dr. Trevor Berry. And you probably know Dr. Trevor well, and Russ Teams. So she goes down to see Berry and Teams. Now this guy, the husband who sees me, this guy is straight medical, Mayo Clinic, executive and stuff like that, you know, so I pull him into my realm. And then he calls me up after he has one meeting with Dr. Trevor Berry, and he said, she has seen 10 neurologists, and all 10 of them spent 1/2 the amount of time as Trevor did, and Trevor actually fixed her by the 3rd visit. I mean, you know, when I talk to him, he's like, she's, you know, 75% better, and then I talk to him, it's almost gone, and then it was gone. So, you know, I mean, case stories like that people like you share all day long. And I've been around brilliant neurologists, and they're smart people, but they're just brainwashed into MRIs and CT scans and trying a pharmaceutical. It doesn't work. And then another one doesn't work, and then it doesn't work. And that's what happened to my father. And now my father's gone. So let's talk about how we can save everybody else's father.
Yeah, and that's what you're doing in Arizona right now with your clinic. You've shifted that kind of the paradigm and how you treat patients too. I was listening to a talk that you did with Tom Bilyeu. I forget how to say his last name, but you were talking about how you're spending a ton of time with the patients doing a complete workup, but not just addressing the heart. You're looking at the cause of things. Can you kind of take us through what it looks like working up a patient now that you've changed into this new way of helping people?
Yeah, most certainly. You know, what I really start with is trying to identify kind of what the issues are, what are the pain points that the person is having. So, you know, they're on pharmaceuticals and they would like to get off pharmaceuticals, or they're having side effects, or their condition is getting worse. So once again, so if we identify, hey, listen, somebody has, they've already had a heart attack, and we want to prevent the next heart attack, but they're taking pharmaceuticals and they feel worse. So they had some kind of scan that says things are getting worse, or they've had a second stent or a third stent or needed bypass surgery. So let's really talk about why they are forming all of this coronary artery disease. And just like I do in my book, we talk about nutrition, and nutrition is certainly part of it. But nutrition to me, and tell me if you disagree, Doc, nutrition is no more important than sleep. That's for sure. Sleep, I think, is probably the most important factor. So nutrition is no more important than sleep. Nutrition is no more important than sunshine. All of nature is outside in the sun. All plants and animals and all life is outside. We're the only people that are inside as we're having this conversation right now. Maybe next time, we're doing this and you're in your area and I'm under some thatched hut on some island or whatever. I don't know, but
deal
is nutrition any more important than environmental pollutants and toxins and chemicals, air pollution, indoor air pollution, laundry detergent, fabric softener, dryer sheets, colognes, perfumes, on and on? Is nutrition any more important than stress? No way, no way. When you have stress, anger, depression, feelings of loneliness, you're at major risk. So again, there's a lot of debate in the nutrition space. I don't think there's any debate because we're hunter-gatherers and we've been so for, for millions of years. But in these other areas, there really is no up for debate. But again, the medical doctor, the traditional cardiologist, they've got no training in this. They've got no time to discuss this. And it's sad. It's sad for the doctors that spent all those years and all they can do is prescribe pharmaceuticals or order a test, as opposed to, again, becoming a doctor of cause.
It makes sense. It's always the simplest things, just making those positive changes in your life can have the biggest profound impact on your health. But it is always multifactorial. You can't just rely on one thing. Can you talk a little bit about the book? So it's called The Paleo Cardiologist. Awesome book. Got it on Amazon. So make sure, look out there, or if you recommend anywhere else to get it. But can you talk a little bit about why the title, why paleo, just a little bit into that? And it's not just about nutrition, but can you touch on The Paleo Cardiologist?
Sure thing. And if you want a copy for free, all you got to do is pay shipping, and you can come to the website, Wolfson Integrative Cardiology, and we'll send you a copy, just pay for shipping. You can give it to Amazon. I got nothing matter with Amazon. I use Amazon, but Amazon has enough enough income, enough support. Yes. Come on over to our website and check it out. And it'll be cheaper when you pay for shipping. Why paleo? When I was a cardiology fellow back in 2000, long time ago. So in the year 2000, I was at the American College of Cardiology meetings. Tens of thousands of people are there, cardiologists, all the pharmaceutical companies, the whole thing. It's the biggest cardiology meeting in the world. And I saw a debate between Dean Ornish of low-fat fame and then the late Robert Atkins of low-carb fame. And I walked out of this debate seeing these two titans in nutrition and health go at it. And they hated each other, by the way. They hated each other. But I walked out of there and I said, I am a low-carb guy. It just made the most amount of sense. It made sense that anything in nutrition that spikes insulin is going to be bad. It's going to be bad for your heart, bad for your brain, bad for your liver and kidneys and everything else. So we want to keep insulin levels real low. And with that, when I met Dr. Heather, I kind of lost... I wasn't following that. I was eating garbage food, like I said, as a cardiologist. And even though I had some philosophy behind it, when I met Dr. Heather and we started talking, then I started reading some books and really getting into nutrition. And I read some really foundational books at the time, certainly about clean eating. So no matter what diet you're on, get the garbage out of there, get the chemicals out, get the artificials out, make sure everything's organic, no pesticides, all that kind of stuff. So I'm reading those kind of books, and then I come across a book by Lauren Cordain, and it's called The Paleo Diet. So I read The Paleo Diet. It made perfect sense. And then I started researching the stuff that he had read and those authors. I came across a book by a GI, a gastroenterologist from the mid-1970s called The Stone Age Diet. And in the Stone Age Diet, he's basically recommending 2/3 plus animal products, not even so much seafood. And if you're a vegan out there, if you're a vegetarian, please, please, please eat seafood and please feed your kids seafood. But the Stone Age diet was really, and I think that's really, that philosophy has kind of given birth to a lot of the modern carnivore diet. And that's a whole separate discussion, but I love talking about that. But then then finally, what I think is really the ultimate piece on nutrition is by Weston A. Price of the Weston A. Price Foundation. So he's a dentist in the 1920s, travels all around the world with his wife, and he sees that the people that are eating their native ancestral foods live the longest, and basically they're hunter-gatherer foods, they're well-prepared foods. If it's dairy, it's raw, and all that stuff really just started making sense, and that's how he synthesized it into what I am now. Ryan, the two things that I always am, I'm always organic, and I'm always gluten-free. So whatever your vice is, be it coffee, ice cream, cookies, do it organically, keep the chemicals out of the food. And then once again, stay away from gluten. I don't know what your thoughts are on gluten, but I think, basically gluten is one of those things that causes leaky gut, causes leaky heart. And in your realm, leaky brain, and we can measure all that. We can measure all that.
Yep. Oh, absolutely. Can you, and I've heard you say the term leaky heart before. Can you talk a little bit about what leaky heart means?
Yeah,
And I'm
certainly.
100% with you on gluten, man. It's a killer.
It's just not ancestral food. We can do gluten testing on so many people, looking not for necessarily gluten allergy, but gluten sensitivity. And when we test people, leaky gut panels on those people, and 2/3 of people that consume gluten have some evidence of leaky gut and gluten sensitivity. So basically, what leaky heart is that just when we say leaky gut, it means the lining of your gut leaks, meaning things get into the body that should get in, but things get into the body through the gut lining that should not be getting in. They're passing through that gut membrane. Well, we have a leaky gut. We also have a membrane that lines the blood vessels, and that is called the endothelium. And the endothelium is controlled by various factors, but if it starts to open up and starts to leak, now you get things that don't belong on the inside of the blood vessel, getting inside the blood vessel, leading to inflammation, immune system activation, immune cell recruitment, oxidative stress, which eventually culminates in plaque and then heart attack. But if we go back and seal that gut, if we seal the heart endothelium, and in your realm, of course, it's called the blood-brain barrier. That's where the leaky brain happens. And if we can seal all that, we're gonna live a long time with minimal, if any, symptoms.
100%. Yeah, I feel like we talked about this earlier, but I feel like the heart is just something that we don't really focus on as much in chiropractic, and then also kind of just from the functional medicine perspective, we don't really talk about heart health as much as we should, which is why when I heard you speak in Montreal, I was like, man, I gotta check this guy out and see what he's doing. So we've got your book here. There's tons of good information in here. I don't want to keep you too much longer, but I do have a couple questions from the book. So one question was, I was out on my back porch reading, and the chapter on sunlight. So I'm sitting on the back porch reading. I'm in my board shorts. I'm getting some sun myself. And then you talk about how important it is to make sure that you get sun health every day for cholesterol. Can you talk about like the sunlight cholesterol relationship and vitamin D and all that, and heart health?
Yeah, most certainly. So if you're listening to
I didn't go fully naked because my neighbors were outside, but I did read it in your.
Okay, yeah. So I thought that's where you're going with it. I'm glad you did. But that being said, our ancestors ran around naked. So if we think about, for example, like Tom Hanks in the movie Castaway. Tom Hanks in Castaway, he's on the remote island. On the island, he goes to sleep with the sundown, awakes with the sunrise, gets tons of sunshine all day long. He's naked. He's in and out of the sun. He's eating coconuts, fish, and avocados. If we do that, we're going to live a very long time. Now, if we say the word cholesterol, what do you think? If you're watching this, if you're listening to this, what do you think if we say cholesterol? You think heart attack. You think eggs. You think bad. And we want to teach people is that the body makes cholesterol for a reason. All animals on the planet make cholesterol for a reason. Actually, dozens, if not 100 reasons, if not reasons obviously we don't even know yet, of course. So all of our cell membranes, the fence or the brain of the cell, which is not the nucleus, the brain of the cell is the membrane that keeps things inside the cell that belong and keeps things outside of the cell that doesn't belong. And that's all loaded with cholesterol. The vitamin D, as you mentioned, the sun hits the skin and turns cholesterol in the skin into vitamin D. Everybody knows the highest level of vitamin D equals lowest risk of everything. Cholesterol is very important for our digestion because it's made in the liver. The liver puts it in the gallbladder, squeezes it on top of food to help emulsify our fats so we can absorb the fats and get all the benefits of fat. And of course, and that all goes to the brain and stuff like that. The brain is loaded with cholesterol. Again, I want to stress this again. Every single cell membrane has cholesterol in it. Inside of the cell are things called organelles that make all kind of cool stuff happen. That has cholesterol. And then last but not least, if you're interested in this, men, cholesterol becomes testosterone. Women, cholesterol becomes estrogen and progesterone. So these things all should occur in a perfect balance. And the problem is we're not living in balance with nature. And that's what my book is all about. And I think patients, if you go to my website and you see my reviews or reviews of the book, I think you'll be pretty pleased.
Yeah, great reviews. And then there was one last thing. So you mentioned sleep earlier, and you mentioned in your book during a 10 to 15 year follow-up, short sleepers less than 6 hours, they had a 23% higher risk of coronary artery disease compared to normal sleepers. I mean, to me, when I read that, I was like, that's nuts. We just had a son a little over a year ago, and sleep was a challenge, but now we're getting it all figured out. How important is that for heart health? Just getting good sleep.
Well, listen, being a parent means giving up on sleep a lot and really trying to do the best that you can. So, because I get that, because we've got 3 kids and we've been kind of dealing with things over the last 12 years. But that being said, not only does sleep have impact on cardiac risk and stroke risk and atrial fib risk and heart failure risk and hypertension risk, but it also, as you said, less than 6 hours of sleep, much higher risk of dementia, much higher risk of cognitive issues. So when they look at people that if they sleep deprive them, their memory and recall of new things that are learned is markedly decreased, 40%, 70% reduced. So it's almost like if you don't get sleep, and adequate sleep, you don't form any new memories. You're not having any new value to yourself, which is unfortunate because as you're going through chiropractic school and you're going through your neurology training, and I'm going through my 10 years of post-undergrad training, and on the job, a lot of it was sleep deprived. And it's sad, it's unfortunate, it is a crisis. And it's something, again, that we need to really get a handle on before, no matter what version you believe in, if it's the biblical version or the evolutionary version, the sun, first of all, there was darkness, and then there was the sun. And then if there's sun and there's darkness and there's earth and there's rotation, there's darkness and there's light, and there's darkness and it's light. And it came here before we were here. So again, sleep, I think, is the most important factor if I had to rank all of them. I think you can eat the best diet in the world, but if you're sleep deprived, you're in trouble.
Awesome. That goes into my last question. For the viewers, can you just, if you had to pick a top 3 for good heart health and good brain health, what would you rank top 1, 2, and 3? What could people do to have better health?
Well, I think, let's just take the nutrition picture out of it. I think if you've got stress in your life, I think you need to get rid of it, because stress will impact sleep. It'll impact your ability to go out and get sunshine. It impacts, it impacts your food, right? If you're stressed out, you're not reaching for a broccoli salad, you're reaching for cereal or ice cream. So really work on strategies to get family out of your life. I'm not saying it's easy. I'm saying that if you want to live, you better do it. So that would be number 1. I do think, I'm a huge fan of chiropractic, not because my wife is a chiropractor, not because I've got thousands of chiropractic friends. It's because that is the foundational, fundamental way to health and wellness, is by following the plan of your doctor of chiropractic, in the sense that following, I think paleo lifestyle should be synonymous with chiropractic lifestyle. Really, I do. So again, finding a holistic doctor to guide you on this path to health and wellness, so we can get away from medical doctors, get away from pharmaceuticals, becoming a doctor cause. Chiropractic lowers blood pressure, proven, lowers inflammation, proven, increases heart rate variability, and that's proven as well. So there's a lot of things, and again, the brain is connected to the heart through the autonomic nervous system. The heart's connected to the brain through the autonomic nervous system. That better be traveling at the speed of light to make things happen. And if you have subluxation, if you once again, if you're not under the care of a doctor of chiropractic, you're not going to be functioning at optimal, and you're going to suffer the consequences. So we said to get the stress out, get chiropractic care. And then number 3, again, take a look around at your house. Get the chemicals out of your house. Everything you bring in, is it natural or not? Is it organic or not? If it's not natural, not organic, don't bring it in the house. laundry detergent, fabric softener, dryer sheets, Glade plugins, perfumes, colognes, toothpaste, shampoos, cleaning agents, new mattress, new furniture, you name it, you name it. You know, we're even doing research right now because we're going camping. We're looking for organic wool sleeping bags, and we found them. So they're expensive, but they're going to be worth it. And
It's a
I
good
don't want
investment.
myself or my kids sleeping in poison.
Absolutely. Well, hey, I can't thank you enough for all the work that you're doing. You know, I know all your patients are so grateful for having someone like you and your wife guiding them in their health. So just keep doing what you're doing, man. You're an amazing guy, and this book is amazing to all of our viewers. Please check it out, and I'll make sure to post all your links to your to this chat. So thank you so much, Dr. Wolfson. I really appreciate your time.
Excellent. Thank you. I appreciate being on. And you know, go see your chiropractor. If you got anything, go run out and see your chiropractor. If you need somebody that, and you're not sure who to go, obviously you got Dr. Ryan, but of course we can help guide you to find the best people in your area.
100%. All right, hang tight.